Hi, I'm Mel Robinson and I'm the CEO of Katzenham. Today I want to talk about racism in the health system. Racism exists in the health system and this can be seen through the number of patients who are discharged from hospitals against medical advice. It can be seen in the poor health outcomes that Aboriginal and Torres Strait Islander people experience in Australia every day. An example of this is Dr. G. Dr. G was a worldwide famous musician and recently passed away. Prior to him passing away, he was admitted to hospital and he was treated very poorly by the hospital staff because of him being Indigenous. At the time, he had hepatitis B, which he had caught as a child, and it was impacting on his liver and he was very unwell, but they left him for a significant period of time in the waiting room, which impacted on his health outcome. Sometimes this is not a deliberate intention or a malice intention, it's just the way the health system treats our people, and I think there's a lot of lessons that can be learnt to address it. There's also many other examples, including the case of Miss Dew, who was held in a lockup in Port Hedland, a small town in Western Australia, and she presented through the police, was escorted to the hospital a number of times, complaining of significant pain and feeling unwell. When you read the coroner's report, you can see that she was treated unfairly and she was labelled as a drug seeker, and as a result her care was compromised because of her being Indigenous, and there's clear evidence of that in the coroner's report. What we can do to address racism is we need to get more Aboriginal and Torres Strait Islander people working in the health systems, and that could be within hospitals or that could be out in community health settings or anywhere where health services are providing care to Aboriginal and Torres Strait Islander people. And as the CEO of the Congress of Aboriginal and Torres Strait Islander Nurses and Midwives, I more than anyone understand the importance of this. As an Aboriginal nurse myself, when I have worked in hospitals and health services, the difference you see in the way families and patients interact with you, because I am Indigenous, is phenomenal. I used to have people coming up to me on the wards, asking me for assistance, asking me for medical advice, and like most nurses, I get that request all the time through my family as well. I think we need to get more Aboriginal and Torres Strait Islander nurses and midwives into the system. We need more doctors and we need more allied health workers as well. And there is a lot of work being done in that space. But another big piece of work is getting our clinical staff who are non-Indigenous involved in cultural safety training and understanding the issues and the challenges for our Aboriginal and Torres Strait Islander patients and their families. This can be done through online training and also through face-to-face training as well. It's really important in addressing racism that people understand that the history of Australia and the way Aboriginal and Torres Strait Islander people were treated by the first settlers, and with government policies around assimilation and the Aboriginal Protection Acts, which were brought in varying degrees across Australia, how they forced the removal of Indigenous children, and that as a result has created a number of health issues. And it's unfair of non-Indigenous Australians to tell us to get over it, because those issues still exist today, and there's people who are still living in Australia who were actually removed from their families, and the trauma from that and the trauma that continues is significant. This impacts on their mental health, on their physical health, and on their emotional health as well. Another thing that happened as a result of those stolen generations was the removal off country, off land, and also the suffering and pain that was caused by not knowing your family and not learning your language and not learning your culture. So they're significant issues. Another significant issue is the fact that non-Indigenous Australians often don't understand the struggles that are going on in Aboriginal communities and Torres Strait Islander communities. Often non-Indigenous Australians will say they don't know an Aboriginal or a Torres Strait Islander person, and it's really important that non-Indigenous Australians take that opportunity to go out and meet people in their community. And this can be done through attending NAIDOC events or going out on significant events like Reconciliation Week or attending Sorry Day events where, in recognition of the apology which Kevin Rudd gave to Indigenous Australians who were removed from their families. So there's a lot you can do. I'd also encourage people in addressing racism to learn about culture and history. So go on tours, ask questions, look at videos online, but actually develop a sense of pride in the culture and in the history of this country as well, and a sense of pride in the first people of this country. We have some amazing artists and actors and performers, and there's lots of opportunities to learn about Aboriginal and Torres Strait Islander people. So that is another way to address racism. I think the final way, and probably the most important way, is if you see racism, when you're out in the community or when you're at university or school, it's really important as a non-Indigenous Australian that you call that out and you say something to the person who is being racist. And sometimes it's really difficult to do if someone is being, quite rude or aggressive, but it's really important. And when Aboriginal and Torres Strait Islander people see non-Indigenous people calling out racism, it's important, because sometimes people don't believe it exists and sometimes they think that we're making it up, and it's actually not the case. And racism happens every day in our society, and it's not always against our people, but it's against all sorts of different groups in our society. So I think that's one thing that people can do that's really important. But also encourage people in your family and other people to learn more about our culture and our history and be more involved as well, and be more proud of who we are. Our history is much longer than the 250 years since Captain Cook came to Australia. Our history goes back thousands of years, and there's lots of ways you can learn those stories and learn about that culture. And I would encourage everyone to do that. In terms of long-term health effects, we're doing a lot of work around cultural safety training and helping health services to better care for Aboriginal and Torres Strait Islander people. And we're also supporting growing the workforce as well, which is really critical. But also letting government know and policymakers know that when they're creating programs and policies, they need to seek advice, but also involved Aboriginal and Torres Strait Islander people in the writing, in the development, in the setting the agenda, so health can be improved for all Australians. At the moment, our people are really suffering, and they really, really need everyone to make sure that we all work together for a better Australia.